7 serious signs of colon cancer that can kill you. Have you ever stopped to think that your own body might be screaming for help and you just don't notice? Common symptoms that many people ignore daily can actually be warning signs of one of the most silent and deadly diseases in the world, colon cancer. Believe me, it's scary to know that this type of cancer can develop for years inside your body without causing obvious symptoms. And when they show up, they can be mistaken for simple things like a stomach ache, gas, or bowel changes. And that's exactly where the danger lies. What seems harmless could actually be putting your life at real and immediate risk. Ignoring these signs can cost you dearly, much more than you imagine. And when you finally notice, it might be too late. But the question that won't go away is, how do you tell the difference between a passing discomfort and a symptom that might really be revealing a silently developing cancer inside you? Do you know which signs should never be ignored? And pay attention, because in this video you won't just discover the 7 most serious and dangerous symptoms of colon cancer. No, that would be too little. I'll also reveal, at the end, the most powerful and effective habits science knows to help prevent this deadly disease. Maybe what you'll hear here today could literally save your life, or the life of someone you love. Because when it comes to colon cancer, ignorance costs lives, and knowledge saves. So get ready, because what you'll discover now might be the most important health content you've ever seen in your life. Number 7. Frequent vomiting. When we think of symptoms that may indicate a serious intestinal problem, vomiting rarely comes to mind immediately. However, in the case of colon cancer, this sign is extremely worrying. That's because vomiting can be directly linked to intestinal blockage caused by tumor growth. When the intestine is blocked, food and liquids can no longer follow their natural path. So, the body tries to eliminate this content backward, causing episodes of vomiting that become more and more frequent. The problem worsens when this obstruction is not noticed early. Vomiting can start sporadically, usually linked to episodes of discomfort or a heavy stomach feeling. But as the tumor grows, these episodes become more constant and intense. It's common for the person to vomit even without having eaten recently, which causes a lot of concern and discomfort. Unfortunately, this sign is often mistaken for simple gastrointestinal upset. Another important point is to watch if vomiting is accompanied by other symptoms, like intense abdominal pain, bloating, and absence of bowel movements. This indicates that the intestinal blockage is worsening quickly. When intestinal transit is interrupted, waste and gas accumulate, pressing organs and intensifying vomiting episodes. This is a condition that requires urgent medical attention and often surgical intervention. Have you ever thought that ignoring frequent vomiting episodes could cost your own life? Many people believe it's just a result of bad eating, stress, or passing viruses. But in truth, when vomiting is persistent, especially without an apparent cause, it's a clear sign that something very serious may be happening in the body. Colon cancer is sneaky exactly because it starts with subtle signs that easily go unnoticed. Besides the discomfort, frequent vomiting quickly leads to dehydration, electrolyte loss, and body weakening. This worsens the condition of someone already facing cancer. Lack of fluids and nutrients compromises kidney, heart, and brain function, leaving the person extremely debilitated. And if not treated in time, the blockage can become a severe medical emergency with a risk of death. Therefore, it's crucial to understand that frequent vomiting should never be normalized, especially if accompanied by other strange gastrointestinal signs. If you or someone close is experiencing this discomfort repeatedly, seek a doctor immediately. Early diagnosis makes all the difference in colon cancer treatment and can literally save lives. Never ignore what your body is trying to warn you about. Number 6. Persistent abdominal pain. Feeling abdominal pain now and then is common for anyone, whether due to indigestion, gas, or even stress. However, when this pain becomes constant, frequent, and doesn't improve over days, the warning sign should be immediate. In colon cancer, this pain is usually described as intense cramps or constant pressure in the abdominal area. And the most worrying part, often it doesn't stop even after taking painkillers or common remedies for intestinal discomfort. The cause of this pain is directly linked to tumor growth inside the intestine. As it advances, it starts pressing the colon walls and, in some cases, nearby organs. This causes inflammation, partial blockages, and even difficulty with gas and waste circulation. The body responds with pain that becomes more constant and hard to ignore. This pain doesn't pick a time. It can appear during the day, at night, and even wake the person up at midnight. Many patients describe the feeling as a mix of deep discomfort, cramps, and a pressure that seems never to go away. It can also come with bloating, trapped gas, and a constant urge to have a bowel movement, often unsuccessfully. This set of symptoms makes daily life extremely hard, affecting work, sleep, and even simple leisure moments. And unfortunately, it's common for this pain to be underestimated at first, treated as a simple gastrointestinal problem. Have you ever found yourself feeling abdominal pain that seems never to pass? This is a sign your body gives when something serious is happening, and ignoring this symptom can have devastating consequences. Colon cancer often evolves silently, and pain is one of the first cries for help from your body. If the pain persists for days or weeks, especially if accompanied by other signs like weight loss or bowel changes, it's time to seek help immediately. The impact on quality of life is huge, and the longer the symptom is ignored, the more advanced the cancer might be. Persistent abdominal pain must be taken seriously, as it indicates the tumor is growing and directly affecting intestinal function. And stay tuned, because the most serious and dangerous symptom of all will only be revealed in the last chapter of this video. Number 5. Changes in bowel habits. If there's a classic symptom that many people insist on ignoring, it's changes in bowel habits. In colon cancer, these changes can show up in many ways. Persistent diarrhea, constipation lasting days or even weeks, or even alternating between both. This happens because the tumor directly interferes with intestinal function, creating physical obstacles that make stool transit harder or faster. It's very common for people to justify these changes with factors like stress, poor diet, or even anxiety. And yes, these factors really can affect the intestine, but when this situation lasts a long time, the body is actually calling for help. And it's not an isolated discomfort. Bowel habit changes come with a feeling of heaviness in the abdomen, excessive gas, and in some cases, pain during bowel movements. Also, pay close attention to stool shape. In colon cancer, it's common for stools to become thinner, pencil-shaped, indicating something inside the intestine is partially blocking passage. This is a very serious sign, but unfortunately, most people ignore it until it's too late. And believe me, by the time it gets to this point, the tumor might be well developed. Have you noticed your bowel working differently for days, or even weeks, without any clear reason? Know that this shouldn't be seen as normal. Bowel function is a thermometer of our health, and any persistent change must be taken seriously. Prevention saves lives, and early diagnosis can make all the difference in treatment. Ignoring these changes is opening space for the disease to advance silently. Don't let this happen to you or someone you love. And remember, in the last chapter of this video, I'll reveal the most serious and deadly symptom of colon cancer. Pay attention, because it can literally cost you your life. Number 4. Unexplained weight loss. Losing weight without dieting, exercise, or any effort to slim down should always be seen as a big warning sign. In colon cancer, this is one of the most common symptoms and, unfortunately, often neglected. The tumor interferes with intestinal function, impairs nutrient absorption, and on top of that, consumes a lot of the body's energy, causing rapid and unexplained weight loss. You wake up, notice your clothes are looser, the scale shows lower numbers, and even without understanding why, you think it's a good thing. But the truth is your body is signaling that there's a serious problem going on inside. When the body has to fight a disease like cancer, it enters a constant inflammatory state. This demands a lot more energy and speeds up involuntary weight loss. Besides visible weight loss, this symptom usually comes with weakness, constant tiredness, and even muscle loss. The body starts to wear down quickly, as if consuming itself. And in most cases, this process happens so silently that the person only notices when the loss is already significant, often more than 5 or 10 kilos in a few weeks or months. This rapid weight loss shouldn't be seen as positive. On the contrary, it's a warning that the body is suffering. And unfortunately, it often appears when cancer is already in an advanced stage. So any unexplained weight loss needs urgent investigation without excuses or delays. Imagine the impact this sign can have on your life if ignored. Unexplained weight loss isn't just a detail. It's a consequence of something very serious happening inside you. And get ready, because the most dangerous symptom, the one that puts your life most at risk, will only be revealed in the last chapter of this video. You can't miss this information. Number 3. Intense fatigue and weakness. Feeling tired occasionally is perfectly normal, but when fatigue becomes constant, deep, and unexplained, it's a sign that something very serious might be happening. In colon cancer, this symptom is extremely common and directly related to processes like anemia and malnutrition. The tumor's presence can cause hidden bleeding in the intestine, which goes unnoticed but leads to continuous iron loss and a drastic drop in red blood cells. This anemia causes oxygen not to reach body tissues properly, causing extreme tiredness, lack of energy, and often even difficulty doing simple daily tasks. Activities like climbing stairs, walking short distances, or even talking can seem very exhausting. It's exhaustion that doesn't improve with rest and gets worse over time. Besides that, the inflammatory process caused by cancer demands a lot from the body. The body stays in a constant alert state, fighting the tumor while trying to keep basic functions. This causes huge energy drain, muscle loss, immune decline, and generalized weakness that compromises quality of life. Imagine waking up already feeling exhausted, unmotivated, weak, and with a constant feeling of discomfort. Unfortunately, this is how many people with colon cancer feel daily, unaware this might be directly linked to disease progression. And worse, many think they're just going through a phase of stress or normal tiredness, delaying seeking help. If you or someone close is facing this kind of fatigue that doesn't improve, don't ignore it. Extreme fatigue, especially when linked to other gastrointestinal symptoms, is a strong warning sign for something very serious. And pay attention. The most deadly symptom, the one that represents the biggest danger to your life, will only be revealed in the last chapter of this video. You need to know what it is. Number 2. Feeling of incomplete bowel evacuation. Few things are as uncomfortable as the constant feeling of not being able to completely empty the bowel. In colon cancer, this symptom is very frequent and unfortunately very underestimated. People start feeling a constant need to go to the bathroom, as if there's always something left to be eliminated, even after apparently normal bowel movements. It's an anguishing feeling that repeats several times a day. This symptom happens because the tumor inside the colon acts as a physical barrier, making complete stool emptying difficult. The body tries to compensate, causing spasms and contractions in the intestine, which makes the person have the false impression that they need to evacuate again. Also, swelling and inflammation caused by the tumor increase this discomfort, turning every bathroom trip into a frustrating and tiring episode. Another very common sign is to notice changes in stool frequency and shape. They might become thinner, fragmented, or even come out in small amounts, giving a sensation of partial evacuation. This discomfort impacts not only physical well-being, but also mental health. After all, living with the constant need to go to the bathroom without full relief causes anxiety, irritability, and even social isolation. Have you ever wondered if this feeling of incomplete evacuation, which you sometimes ignore, might be your body trying to warn you about something much more serious? Unfortunately, this is one of those symptoms that, because it's seen as common, ends up being neglected, letting cancer keep evolving silently inside the body. And it's exactly the silent evolution that makes colon cancer so dangerous. The feeling of incomplete evacuation is more than just an annoyance. It's a cry for help from your intestine. And get ready, because in the next and last chapter of this video, I'll reveal the most deadly symptom, the one that represents the greatest risk to your life, and if ignored, can have irreversible consequences. Number 1. Abdominal bloating and excessive gas. If there's one symptom that, despite seeming simple, can be extremely sneaky in colon cancer, it's persistent abdominal bloating accompanied by excessive gas. Almost everyone has felt abdominal discomfort, especially after a heavy meal, right? But when this bloating becomes constant daily and doesn't improve, it goes from simple discomfort to a very serious warning sign. The cause of this bloating is directly linked to the partial blockage the tumor creates inside the intestine. With waste passage compromised, gas and stool accumulate, causing constant pressure in the abdominal area. The belly looks visibly more swollen, rigid, and often painful to touch. And it doesn't matter if the person eats little or even fasts, the bloating remains, showing something very serious is happening inside. This condition, besides being uncomfortable, is extremely dangerous because excessive accumulation of gas and waste can lead to total intestinal blockage. And when that happens, it becomes a medical emergency with a very high risk of death. Symptoms worsen quickly, with severe abdominal pain, projectile vomiting, complete absence of bowel movements, and even fever, indicating the intestine is collapsing. The big danger is that, unlike other more visible signs like blood in the stool, bloating tends to be underestimated. People think they just have indigestion, irritable bowel syndrome, or too much gas. And so, cancer keeps evolving silently. Often, when the patient seeks help, the tumor already compromises a large part of the colon, making treatment harder and riskier. So be alert. Daily abdominal bloating that persists for days or weeks, associated with excessive gas, discomfort, and a heavy belly feeling, can indeed be the most serious and deadly symptom of colon cancer. And the scariest part is that it usually appears when the tumor is already quite advanced. If you notice the sign in your body, don't ignore it. Seek medical help as soon as possible. And if you've made it this far, know that in the next chapters, I'll show you simple, practical, and extremely powerful habits that can help prevent colon cancer. Small changes in your daily routine can be the key to protecting your health, improving your quality of life, and even saving your life. You can't miss this next information. Habit 5. Maintain a diet rich in fiber. When we talk about preventing colon cancer, one of the most powerful and scientifically proven habits is adopting a diet rich in fiber. Fiber is essential for good intestinal function because it helps speed up bowel transit, facilitating the elimination of waste and toxins that, if accumulated, can favor the development of cancer cells. The more efficient the intestine, the less time these substances stay in contact with the intestinal wall. Fruits, vegetables, legumes, and whole grains are the best sources of natural fiber. And the coolest thing is that besides protecting against colon cancer, a fiber-rich diet also helps prevent heart disease, diabetes, and even maintain weight. It's care that benefits the whole body. And the best part, it's easy to put into practice daily, without big restrictions or sacrifices. Did you know, for example, that just including an apple, an orange, and a portion of beans daily already makes a huge difference in your fiber intake? Small changes like swapping white rice for brown rice or adding more leafy greens to meals can transform your intestinal health and significantly reduce the risk of colon cancer. Another benefit of fiber is that it feeds the good bacteria in the gut, known as gut microbiota. This bacterial balance not only improves digestion, but also strengthens the immune system. A healthy, regular, and balanced gut becomes a true shield against various diseases, including cancer. Lack of fiber, on the other hand, is directly associated with constipation, intestinal inflammation, and higher risk of developing polyps, which are precancerous lesions in the colon. That's why adopting a natural diet rich in real food is not just a smart choice. It's a decision that saves lives. And this is just the first habit that can protect your body against colon cancer. In the next chapter, you'll discover how regular physical exercise can be a powerful ally in preventing this silent and dangerous disease. Stay with me because this knowledge can transform your life. Habit 4. Avoid excessive consumption of red and processed meats. Did you know that excessive consumption of red meat, and especially processed meats, is directly linked to increased risk of colon cancer? This is not a myth or exaggeration. It's a reality proven by countless scientific studies. Foods like bacon, sausage, ham, salami, and sausage are considered big villains when it comes to intestinal health. The problem lies in the chemical compounds used to preserve these meats, like nitrites and nitrates, which during digestion can turn into highly carcinogenic substances. Besides that, the cooking process at high temperatures, like grilling and barbecuing, can produce toxic compounds also linked to increased cancer risk. This doesn't mean you have to cut meat out of your life completely, but it's essential to reduce consumption and seek balance. Choose lean meats, prefer chicken, fish, and whenever possible, include more vegetarian meals in your routine. Replacing animal protein a few times a week with legumes like beans, lentils, and chickpeas is a simple and very effective strategy. Besides reducing processed meats, it's worth investing in healthier cooking methods like boiling, baking, or steaming. These choices significantly reduce the production of harmful compounds for intestinal and overall health. It's important to understand that the intestine directly responds to the foods you choose to eat. And when these choices are balanced, your health thanks you a lot. And get ready, because the best habit of all, the one that most protects against colon cancer, will only be revealed in the last chapter of this video. And I promise you, you won't want to miss this information. Habit 3. Limit alcohol consumption. Alcohol is part of many countries' culture, present in celebrations, gatherings, and moments of relaxation. But what few know is that excessive consumption is directly linked to increased risk of several types of cancer, including colon cancer. This happens because during alcohol metabolism, the body produces a substance called acetaldehyde, which is highly toxic and carcinogenic. This substance directly damages cell DNA, favoring mutations that can lead to tumor development. Also, alcohol contributes to inflammatory processes in the body, weakens the immune system, and interferes with absorption of essential nutrients, leaving the body more vulnerable to various diseases. And it's not just heavy drinking that brings risks. Studies show even moderate, frequent consumption is linked to a significant increase in colon cancer risk. This means that the habit of just one glass a day, or a drink on weekends, should also be carefully evaluated. The good news is that reducing or eliminating alcohol brings almost immediate health benefits. The intestine works better, inflammation decreases, the liver recovers, and the whole body operates in a more balanced and protected state. If you like socializing, know that it's totally possible to have an active social life without relying on alcohol. Try non-alcoholic drinks, natural juices, sparkling water with lemon, or functional juices. Your body and health will thank you a lot for this choice. And this is just one more powerful habit to protect your gut. In the next chapter, you'll discover another essential point on this prevention journey. And stay tuned, because the most important habit, the one that makes the biggest difference, will only be revealed in the last chapter of this video. Habit 2. Don't smoke. If there's a habit that harms almost every organ in the body, it's smoking. Cigarettes are a major risk factor for several cancers, and yes, that includes colon cancer. Cigarette smoke contains over 70 proven carcinogenic substances, which circulate in the bloodstream, reaching not only the lungs, but also the intestine and other organs. By smoking, these toxins damage cell DNA, favoring mutations that over time can lead to malignant tumors. Specifically for colon cancer, smoking is associated with increased development of polyps, small lesions that if untreated can turn into cancer. Besides that, smoking weakens the immune system, favors chronic inflammatory processes, and harms intestinal function. Studies show smokers are more prone to develop not only colorectal cancer but also inflammatory bowel diseases like ulcerative colitis and Crohn's disease. And it's not just traditional cigarettes that pose risks. Cigars, pipes, and even e-cigarettes release harmful substances that directly impact intestinal health and increase cancer risk. That's why quitting smoking is undoubtedly one of the most powerful decisions anyone can make to protect their health. If you smoke, know it's never too late to quit. Benefits start almost immediately. Circulation improves, the immune system strengthens, and the risk of developing cancer, including colon cancer, progressively decreases. And get ready, because the best habit of all, the one that offers the greatest protection against colon cancer, will be revealed only in the next and last chapter of this video. Habit 1. Regular preventive screenings. Among all the habits that help prevent colon cancer, this is without a doubt the most powerful, effective, and life-saving. Having regular preventive screenings. Unlike many other types of cancer, colon cancer can be totally prevented if detected early in the polyp phase, which are precancerous lesions. Colonoscopy is the most important exam in this process. It allows visualization of the entire large intestine and, if necessary, removal of these polyps before they develop into cancer. It's a simple, safe procedure, with a huge impact on reducing colorectal cancer cases and deaths worldwide. The most impressive thing is that when diagnosed early, colon cancer has cure rates exceeding 90%. This means that more than treating, this habit allows preventing the disease. And contrary to what many think, it's not an exam only for people with symptoms. It should be done as prevention, especially from age 45 or 50, or earlier if there's family history of the disease. Besides colonoscopy, there are other complementary exams like occult blood tests in stool and sigmoidoscopy, which also help with early detection. However, colonoscopy remains the most complete and effective exam currently available. Having preventive screenings isn't just care for yourself, but an act of love for your family. Detecting early means more time, better quality, and much more health. Never underestimate prevention's power. It's undoubtedly your greatest ally in the fight against colon cancer. And to keep receiving the best videos for your health and well-being, subscribe to the channel. It exists for a very simple reason: to help you become a stronger and happier person. And in the video that's now on your screen, I reveal the mistakes when eating turmeric that harm your body every day. To watch that video, just click on the screen. See you in the next video.